What is modeling and sculpting? This is Dr. Clay Williams with Elite Enhancement of East Texas. I'm going through a lot of questions that have come through in the last several days and weeks. I haven't had time to get to them. And this is actually a question we don't get very often. This is something we discuss, modeling and sculpting, at almost every single visit that we have with our clients. But we'll just say this gentleman's name is John, and in some of the bullet points on our webpage, enhancedtexas.com, we mentioned modeling and sculpting, and I commend this gentleman for actually reading, the fine details that we put on the website, because we want you to be well informed. And he actually called us out on it and asked, what do those two terms mean, before he even came in for one official visit. Okay, so modeling is where a week after our first round of injections, and almost at every single injection therapy, we actually model out. We kind of squeeze and move the existing hyaluronic acid that we injected at the previous injection to try to smooth out any irregularities, any lumps, bumps, or divots, and try to smooth all that out, because the hyaluronic acid is very fluid for a while, and it tends to shift back and forth as you go from a non-erect to an erect state. And that's what we want. We want that hyaluronic acid to go down the length of the penis, so that when you get an erection, your girth isn't decreased because of the erection. It's really awesome how this works. So we do modeling at almost every single visit. Sculpting, on the other hand, is where we actually have to inject a little more hyaluronic acid, either because there's a little area that we just can't seem to model anymore, or more commonly, at the base of the penis, where there's a higher concentration of hyaluronidase. Now, that's an enzyme that tends to chew up the hyaluronic acid, and it's everywhere in the body. It's not just preferential to the penis, it's everywhere. In fact, it's less common in the penis. But at the base of the penis, what joins your abdominal wall, sometimes you can get a little bit of a divot or a little hinge defect there, and that's the most common place that we have to sculpt, which means we inject a little more hyaluronic acid at those places. But again, the overall retention rate of the girth enhancement is 95% at 2 to 2.5 years. So fortunately, we do not have to constantly rebuild the girth of the penis every 4 to 6 months using the UroFill patented technique, unlike most of the other techniques that are out in the market. So John, I hope this answers your questions. A great question. I appreciate you reaching out. Please go to enhancedtexas.com.